Hello and welcome back to the Jerusalem Post. I'm your host, Jake Laznik, and I'm joined today by Dr. Zack Dvey-Aharon, an internationally recognized AI expert, entrepreneur, and co-founder and CEO of AEYE Health. Dr. Dvey-Aharon has been at the forefront of AI-driven healthcare, developing AEYE-DS, the first FDA-cleared, fully autonomous AI system for diagnosing irreparable diabetic retinopathy without physician interpretation. His work has expanded to AI-driven screening for cardiovascular disease, glaucoma, and other conditions. In 2024, Time named him on its Time 100 AI list, recognizing him as one of the most influential figures in artificial intelligence. With a Ph.D. in machine learning from Tel Aviv University, prior experience in an elite Israeli intelligence unit, and multiple AI startups under his belt, Dr. Dvey-Aharon continues to push the boundaries of AI in healthcare. Dr. Dvey-Aharon, it's been a pleasure to have you here. Let's dive right in. What initially drew you to the field of artificial intelligence, and how did your early experiences shape your career today?
Well, first of all, thank you for having me. And for me, I've always been doing engineering since very early age. And I believe after years of developing software, at some point, I decided that I have more added value doing analytics, data analytics. Drew more to that field, and I felt I have, I think, more creativity in that part. So I decided to focus on data analytics, and that's why I've done my master's and Ph.D. in machine learning. And since then, everything I've done was really in that space.
Did you feel necessarily drawn to healthcare at any point with your topic of research, or did you just kind of find a niche in there? How did that come about?
Actually, before founding AEYE Health, my current company, I've been mostly doing different things around artificial intelligence, machine learning, but not specifically in healthcare. Part of my advanced degrees, master's and PhD, I've involved healthcare applications, but I haven't done that anything else until founding this company. I felt that I think after doing different things that I want to do something more impactful, if it makes sense. And eventually healthcare, I believe, is one of the immediate suspects, when you're trying to choose something more impactful. So that drew me generally to healthcare, and been looking for the right area to build the most impactful solution.
If you could you give us like a explainer on how the AEYE-DS works in a way that the average person without a background in artificial intelligence could understand what it does?
Our product takes images of the eye's retina and find different indications. The most important is to prevent blindness by finding critical indications. Some of them can be so the leading cause of blindness until the age of 77, I believe, is the set of diabetes complications in the eye, namely diabetic retinopathy, diabetic macular edema, and it's fully preventable, which is kind of crazy to say, the leading cause of blindness, and it's fully preventable. So that I think is perhaps the main use case. You have other conditions, glaucoma, AMD, and part of what we're working on is many other indications, systemic ones. But the currently FDA cleared AEYE-DS allows points of care like primary care, endocrinology, a nurse that goes to someone's home to screen patients there using AI, which means that instead of referring you to an eye doctor, which is not always accessible to people, now using AI, without any physician in the loop, no need for physician interpretation, no need for any physician sign-off, you can actually screen those patients and be able to tell someone everything is good, just come back next year, and tell someone else, look, you have a serious problem, we need to refer you to an eye specialist. And that's a fully autonomous AI, unlike rest of AI you've heard of in healthcare, which is a decision support tool. This one is actually cleared by the FDA to do a diagnosis for the patient.
And does this still require someone to come to you to do the screening, or is this something that you can have on any kind of camera or an app maybe that, could send alert to a healthcare provider that it detected these symptoms or conditions?
So this is not for at this point like a self-use at home. You do need a professional fundus camera to do the screening. You can't use any camera. There are particular types of cameras you can use, but generally speaking, it can be used by people without real, experience doing ocular imaging. The most basic use case is when you go to your primary care physician or endocrinologist, the medical assistants, just like they would measure blood pressure, they can also screen for eye disease.
I want to talk a little bit about the high-tech sector in general in Israel and the artificial intelligence aspect of it. So as you know, we are still currently in a war that we've been for a while. So I was wondering your perspective on what setbacks the Israeli high-tech sector has been facing due to the war, and how it's necessarily adapting to these challenges.
Obviously, the war is not doesn't help business. Let's call it this way. I think for our particular company and our cause, because we typically we target the U.S. market, and I don't think we've been at least on the go-to-market side heavily affected by the war. Definitely, I think when it comes to our R&D efforts, product work, etc., which is done out of Israel, then I think we had different employees doing reserve duty service. But I think compared to most other companies that I've been in touch with, I think we were relatively less affected, again, because we target the US market and which I think is was not giving a lot of weight to what's happening the other side of the world.
As a leader in AI-powered diagnostics, what would you tell other companies that also want to integrate AI into their products effectively?
Well, I think AI is changing a lot of things and how we do things, the flow. In our case, we changed the flow of care, for example. So as a primary care physician, instead of referring patients to eye doctors, you can use AI to screen your own patients. So it's a change of flow. I think generally for companies that want to really enjoy the great benefits of AI, and AI has so much potential to change how we work, I think that requires, I think, the right planning, giving AI its centric place and importance. It's very hard, especially as organizations are bigger. It's very hard to truly integrate new technologies, new solutions. So I think it's really about giving it the right space, having the right people think tank how AI can really be used to transform things, not just improve something, but actually transform the way companies work. And in my opinion, if people come to this with the right state of mind, they can have much more effective integration of AI solutions.
Wonderful. And picking off of that, what do you think of the state of the evolution of AI, I guess, in general, or particularly in healthcare, if it's a very rapid thing or if it's a rather stable evolution? And what do you think Israel needs to do in order to remain a leader in this advancing field?
Well, I think AI is really transforming healthcare. Specifically, what we've done is being able to get FDA's approval for a fully autonomous AI that actually diagnoses the patient, and I'm sure this. Obviously, we needed to conduct a number of prospective controlled phase 3 studies to do that. I think in the end, AI is going to this model is going to be copied to many other areas in healthcare, definitely radiology and others. So there's going to be more and more room for innovation. I generally say that the introduction of even ChatGPT and large language models, I think, changed the way the public sees AI and its potential. If you ask people several years ago what they think with regards to AI, and people had more, I would say, suspicious approach to it. Today, people understand AI can do real magic sometimes, and it's really about finding the right solutions. No doubt, healthcare is one of those areas that really scream for AI innovation. I definitely see Israel with many promising startup companies developing AI solutions in healthcare. So I suspect this is going to become a bigger vertical in the landscape of startups. Naturally, we all Israeli startup companies and generally Israeli entrepreneurs, they typically look at the US market, and I think US market needs a lot of innovation in that space. So I hope more innovators would just decide to dedicate their time to healthcare. Of course, there are other many important fields to build ventures around, but I think healthcare has its own magic and impact.
So what made you choose to, really dig down and study on this and pursue a PhD rather than stopping at, a bachelor's or a master's or something like that? Why go to that far level? What extra tools did the PhD give you that other degrees couldn't have?
My personal, I would say, path was always not the typical one. I started my bachelor's degree when I was 12, and so I've finished my that degree before I was drafted to the army. I was always interested in research, opening my horizons, doing new things, and so I was really eager to continue that. And actually, and that's how I've applied to Tel Aviv University during my service in the army, and gladly that worked out. I think during those studies, both of master's and PhD, that actually exposed me, I think, to doing real research in data analytics. So I don't think I would have definitely I don't think AI health would have existed without that period of time in my life. But for me, I think always studying new things is part of what I like, and I really had this opportunity, and really glad I took it.
Finally, what's something that you gained specifically from Tel Aviv University that prepared you for your career in entrepreneurship and innovation AI that you don't think you could have gotten anywhere else?
Well, I think Tel Aviv University is a really special place. I've enjoyed my time there. I think it's obviously an excellent academic institution. I've done actually I had the same instructor for both my master's and PhD, Professor Intrator, and was I think was able to learn a lot from. But I think the whole staff and I think the DNA of Tel Aviv University, I think is such that people feel free to I think to do more themselves and suggest ideas. It's a very I think it's quite open, and so I feel I was able to get really early access when I was doing my master's degree, and even when I started my courses, actually before I had even subject for my thesis, I've had the chance to speak to different potential instructors, see what they're working on. So I think the whole DNA is about providing this open access for students to go talk to people, ask questions. I think there is a support. I think there's quite a lot of support of people who want to try new things. So I feel Tel Aviv University really has it in its DNA. Obviously, I've done my PhD there and not in other places, but based on what I know, it's considered until today the university where most entrepreneurs in Israel come from. So I believe it says something.
Well, Dr. Dvey-Aharon, that is the time we have. Thank you so much for joining us, and we are very excited to see what the future holds for AI health. Thank you very much.
Thank you so much.